Good afternoon. My name is Marcus Ely, and I'm going to talk to you about bloodborne pathogens. Especially in the educational setting, it becomes very important for teachers, coaches to know how to deal with bloodborne pathogens, especially those such as bacteria and viruses, which are present in blood and bodily fluids, and they can cause disease in people. The pathogens of primary concern are hepatitis B and C and HIV. These and other bloodborne pathogens are spread primarily through contact with infected human blood and bodily fluids. Infected bodily fluids can transmit these pathogens through an accidental puncture from a contaminated source, such as needle, broken glass, or another sharp object. Broken or damaged skin, which would be open sores and abrasions, blisters, even a bite. In an educational setting, a child could bite you, and then the mucous membranes of the mouth, the nose, and the eyes. So here are the guidelines to follow in preventing an infection. First of all, you can't know just by looking at someone whether or not they're infected, so we have to treat every body fluid and drop of blood as though it contains one or more of those viruses. So we need to avoid contact with blood and other body fluids. When performing CPR, use a breathing barrier when giving ventilations. Always wear disposable gloves when providing care, particularly when coming into contact with blood or body fluids. If you or the person to whom you're rendering aid has a latex allergy, obviously notify the campus nurse to make vinyl gloves available. Remove disposable gloves inside out and dispose of them properly. Wash hands thoroughly with soap and water. Use an alcohol-based hand sanitizer where you're not near a hand washing facility. And wash your hands as soon as possible when you come into contact with any blood or bodily fluid. Second, we need to reduce the risk of exposure using a sharps disposal container for needles and other sharp objects. Clean and disinfect all equipment and work surfaces that are soiled or may be soiled by blood or bodily fluid using a 1 part bleach to 10 part water solution or another disinfectant solution provided. If exposure does happen, wash a needle stick injury, any cut or exposed skin thoroughly with soap and water. If splashed with blood or potentially infectious material around the mouth, nose, or the eyes, flush the area with water. If it's in the eyes, irrigate with clean water for at least 20 minutes or use a saline or sterile irrigant. Report the incident as soon as possible to the campus nurse or your supervisor. Record the incident by writing it down. Write down what happened, what actions were taken, etc. Seek follow-up care as identified in your school's exposure plan. Remember, being exposed to infectious material does not automatically mean you're infected. Now let's talk about those that would work in certain areas such as special ed, nurses, coaches, custodians, science instructors, where there is a higher risk of coming into contact with blood and bodily fluids. There is a vaccine available for hepatitis B. It's a series of 3 injections that takes place over a period of 6 months, and it is available to those who have a greater risk or exposure or any other employee the principal may deem would need it. Employees obviously may decide not to have the vaccine, but please notify your campus nurse should you decide to have this series of vaccines, and the school will pay for the series and make arrangements for you to receive the vaccines. Cleaning. If it's your job to clean up the blood or bodily fluids, these are the precautions that you must follow. Always wear gloves to protect your hands from contact with the infectious material. Use disposable materials such as paper towels to absorb the blood. Never use your hands, bare hands, to clean up contaminated, sharp objects such as glass. Use a broom and dustpan. Once the blood is absorbed, clean the area with the aforementioned solution of 1 part bleach to 10 parts water. And after cleaning, immediately disinfect all non-disposable equipments used, such as mops, dustpans, for example. If you empty garbage cans, always pick up and carry bags by the top. Don't grab underneath. Never hold them against the body where something might poke you if there's something in there or if the bag is torn and leaking. Sharp objects can penetrate the bag and cut you. If you find a syringe or needle, always use caution. Don't bend, break, or recap the needle. Use a broom and dustpan to pick it up and discard it in the approved sharps container. If you accidentally stick yourself, wash the needle stick area with soap and water and report the incident to your supervisor as soon as possible. Remember this, if it's wet and not yours, don't touch it. So let's recap. Bloodborne pathogens are bacteria and viruses that are present in blood and body fluids. There are 3 primary bacteria and viruses we're concerned with: hepatitis B and C and HIV. Prevention is the primary concern. Prevention first. Reduce the risk of exposure and then follow the protocols if exposed. Wash any injuries, cuts, or exposed skin. Flush around the eyes, nose, and mouth, specifically for at least 20 minutes where the eyes are concerned. Report all incidents and seek follow-up care as needed. And remember, being exposed to infectious material does not mean you're infected. An ounce of prevention is worth a pound of cure.